A wild parrot is a masterpiece of biological engineering, capable of navigating through a dense jungle canopy at high speeds. But place that same animal in a living room, and those exact evolutionary adaptations create severe hurdles for medical care. In the wild, parrots are a target for predators. To survive, they have developed a deep-seated instinct to mask any physical vulnerability, actively hiding symptoms of pain or disease. When an owner notices their bird sitting on the cage floor with fluffed feathers, sleeping heavily, or developing a crusty lesion like this, the animal's metabolic reserves are exhausted. It can no longer afford the energy required to mask the underlying illness. This deception makes standard physical examinations incredibly dangerous. You cannot routinely pin down a sick parrot like you would a dog or a cat. The sheer panic of being restrained by a perceived predator causes an adrenaline surge that can induce fatal cardiac arrest. Diagnosing a parrot requires an entirely different medical discipline. A quiet bird on a perch is often a severe, life-threatening emergency in disguise. To safely evaluate these fragile patients, veterinarians rely heavily on hands-off observation. They calculate respiratory rates, they analyze its posture, and inspect droppings through the cage bars long before making physical contact. When they do need internal metrics, they rely on rapid clinical pathology. That's use point-of-care glucometers to extract immediate, life-saving metabolic data from a single microscopic drop of blood. This animated diagram illustrates an ESR, or erythrocyte sedimentation rate test. By tracking the vertical separation of red blood cells in a tiny tube, doctors gain a rapid, low-stress screening tool that detects hidden inflammatory infections. They also utilize B-mode ultrasonography, bouncing high-frequency sound waves through the tissues to evaluate the musculoskeletal system without the need for invasive, stressful probing. Practitioners must synthesize these disparate data points, from microscopic blood counts to acoustic reflections, without ever putting the animal at risk through physical handling. Once a diagnosis is confirmed, the unstable bird must be sedated for treatment. This cross-section shows the avian respiratory system. Unlike the dead-end lungs of a mammal, a parrot breathes through a complex network of air sacs that creates a continuous, circular flow of air. This unique anatomy processes anesthetic gases incredibly fast. Vets must meticulously pre-oxygenate the patient, flooding their system with pure oxygen for several minutes before introducing any fast-acting sedatives. In cases where the trachea is compromised by disease or obstruction, surgeons bypass the throat entirely. They perform an air sac cannulation, inserting a specialized tube directly into the bird's side to deliver oxygen and anesthesia. The margin for error during these procedures is razor thin. An avian patient can transition from a perfectly stable plane of anesthesia to complete respiratory failure in a matter of seconds. Operating on a bird introduces anatomical variables that are non-existent in traditional mammalian surgery. A parrot's skin is paper-thin, and its total blood volume is incredibly low. Losing just a few drops of blood causes a catastrophic drop in blood pressure, making fastidious hemostasis, the meticulous control of bleeding, an absolute necessity. This compares dense mammalian bone to hollow avian bone. To reduce weight, parrot bones are pneumatized, filled with air. Repairing fractures requires extreme precision. Surgeons thread a screw into a cortex as thin as an eggshell without shattering it. To achieve this, surgeons often rely on external fixators. They place delicate pins through the bone and anchor them outside the body using rigid acrylic bars to stabilize the fracture. An avian surgeon is essentially performing mechanical engineering on a fragile biological frame designed to weigh almost nothing. Surviving the surgery is only the first half of the battle. The recovery ward brings an entirely new set of complications. Parrots possess a high level of intelligence and a strong psychological stress response. If they are anxious, bored, or in pain, they will actively bite at their surgical wounds and engage in severe self-mutilation. This requires complex pain management protocols. Vets also have to fit specialized protective collars on the birds, an extremely difficult adjustment for an animal that uses its beak as a third hand for climbing and balance. The hospital environment itself is highly controlled. The bird must be visually and acoustically isolated from predatory species, The mere sound of a barking dog or a meowing cat will severely hinder their recovery. Post-operative success relies just as much on managing the patient's complex psychology as it does on the physical healing of the tissue. Ultimately, many of the severe medical crises veterinarians treat, such as atherosclerosis and chronic egg laying, are direct symptoms of living in a cage. In the wild, parrots spend up to 75% of their waking hours foraging. In captivity, they are fed from a dish, completely eliminating the need for their natural daily workload. Deprived of physical and mental stimulation, that massive reserve of energy redirects inward, manifesting as severe anxiety and obsessive feather-damaging behaviors. To combat these human-induced physiological conditions, veterinarians increasingly rely on modern interventions like deslorelin implants, which chemically suppress reproductive hormones and lower dangerous blood lipid levels. To successfully save a parrot's life, a veterinarian must simultaneously treat the anatomy of a delicate flyer, the instincts of a prey animal, and the complex mind of a wild bird.